Hello everyone, today we're gonna speak about collagen disorders. Collagen vascular disease, the four most common disorders of this group are rheumatoid arthritis, systematic lupus erythematosus, scleroderma, and polymyositis. The etiology of the collagen vascular disease is unknown, however, the immune system has been implicated. All of these diseases affect the joints, each has systematic effects as well. Rheumatoid arthritis pathophysiology. So, rheumatoid arthritis begins with cellular hyperplasia of the synovium followed by invasion of the synovium of lymphocytes, plasma cells, and fibroblasts. Ultimately, the cartilage and articular surfaces are destroyed. The cause of rheumatoid arthritis is unknown, but the rheumatoid factor is present in 90% of patients. The hands and wrists are the first to be affected, especially the metacarpophalangeal and proximal interphalangeal joints. Compression of lower extremity peripheral nerves can produce paralysis and sensory loss over the leg. Spinal cord compression does not correlate with patient symptoms, and asymptomatic patients may have a high degree of cord compression. Rheumatoid arthritis affects the joints of larynx, cervical spine, and the thermomandibular joints. Here you can see peripheral joints, which is included in this process non-articular muscular structures and systematic involvement. So manifestation involving other system would be from the skin, eyes, lungs, heart, kidney, and peripheral nervous system. Manifestations continue to liver and blood also. Joint involvement, morning stiffness with joints of the hand, feet, wrist, and knees. Nearly every joint is affected. The thoracic, lumbar, sacral spine almost always spared. Cervical spine involvement is frequent. Cryoarteriotenoid arthritis. Then temporomandibular joints is involved also. Joints of the larynx also will be included in this process. Systematic involved would be from the vascular side, this vasculitis, aortitis. Cardiovascular side would be endocarditis, valve fibrosis, and etc. From pulmonary system would be pleural effusions, fibrosis, and etc. things. Here you can see neuromuscular, hematologic, and liver kidney problems. So in this picture, you can see rheumatoid arthritis. This is normal joint. This is osteoarthritis, and this is rheumatoid arthritis. In these three pictures, you can see and compare with these three type of cases. In this case, you can see the fingers, which is suffered by rheumatoid arthritis. So treatments include analgesics, non-steroid anti-inflammatory drugs, methotrexate. Many of these drugs cause anemia, thrombocytopenia, and hepatitis. So that's because of this, we should check also blood test. Steroids are reserved for those patients who fail to respond to first-line drugs such as methotrexate due to the long-term effect of the taking steroids. Surgical procedures such as synovectomy, tenolysis, and joint replacements also we can use. So, systematic lupus erythematosus, an autoimmune disease in which patients produce antibodies to DNA and also to RNA polymerase, cardiolipin, and ribosomal phosphoproteins. Clinical manifestation may be due to the production of the autoantibody, highly specific for a single protein within an organ. Common manifestations are polyarthritis and dermatitis. So here you can see how we can diagnose SLE. It would be antinuclear antibodies, characteristics rash, thrombocytopenia, cirrhosis, nephritis, and common clinical features would be fever, malaise, joint pain, myalgias, and fatigue. So systematic lupus erythematosus also affected to the central nervous system, cutaneous tissue, and pulmonary system, and cardiovascular system, neuromuscular system, hematologic part, liver, kidney. Here you can see the picture with systematic lupus erythematosus. here you can see erythema and another symptoms also. In these pictures, you can see major diagnostic criteria of systematic lupus erythematosus. So, what is the main main treatment? It would be careful preoperative assessment, including CXR, echo renal function, liver function, and PFTs, airway assessment, proper position, peripheral nephropathy, careful muscle relaxation, titration, and etc. things. Next disease is scleroderma, a chronic autoimmune disease of the connective tissue characterized by the formation of scar tissue in the skin and organs of the body and presence of antibodies. The cause of scleroderma is unknown, but the disease process has the characteristics of both a collagen disease and an autoimmune process. Progressive fibrosis resulting from increased collagen deposits in the interstitium and intima of small arthritis and the connective tissue of involved organs is the pathologic hallmarks of the disease. So, limited form of scleroderma tends to be confined to the skin, fingers, and face, often referred to as CRAST syndrome. So, it's C1 is calcinosis, calcium deposits in the skin. R is Raynaud's phenomena, spasms of tiny blood vessels in response to cold or stress. E, this is esophagus dysfunction. S, this is sclerodactyly, which is thickening and tightening of the skin on the fingers and hands. And T, telangiectasis, dilation of capillaries causing red marks on surface of the skin, which you seen before. Systematic involvement would be skin part, cardiovascular part, pulmonary part, renal part. In this picture, you can see the symptoms which we said before. So for treatment and diagnosis, first of all, this is Invisalign, ABGS, PFTS, CXOR, EKG, room air set, full stomach precautions, managing BP, fluid management, avoid hypothermia, careful airway management, ventilation, avoid hypoxemia and respiratory acidosis, possible awake FEOI gridoscope. So regional anesthesia advantages, this is post-operative analgesia, peripheral vasodilatation, and decreased risk of post-operative ventilation support. Disadvantages is regional anesthesia may be technically difficult due to the throat, skin, and joint changes. Next syndrome is Marfan syndrome. This is autosomal dominant inheritance, multi-system fibrous connective tissue disorder, affects blood vessels, walls, tendons, ligaments, cartilage, heart valves, valves, aorta, and other structures, characterized by disproportionately long limbs, long thin fingers, and typically tall stature and the predisposition to cardiovascular abnormalities. So, Marfan syndrome, systematic involvement would be musculoskeletal disorders like growth to about average height, arachnodactylia. This is long limbs and fingers, scoliosis, thoracic lordosis, pectus excavatum or pectus carinatum, high palates and jaws, cardiovascular disorder, dilated aorta, prolapse of mitral or aortic valves, and etc. things. Pulmonary disorder would be spontaneous pneumothorax, sleep apnea, obstructive lung disease, and then would be from the central nervous system, and would be disorder from the eye like retinal detachment, glaucoma, lens dislocation, myopia, and etc. In this picture, you can see the symptoms of Marfan syndrome. Next one is epidermolysis bullosa, a rare skin disease which can be inherited or acquired. The acquired forms are autoimmune. The end result is loss or absence of normal intracellular bridges and the separation of skin layers. The separation of skin layers results in intradermal fluid accumulation and bullae formation. Minor skin trauma produces skin blisters. Involves fingers and toes mostly. Esophageal involvement is common, resulting in the dysplasia and the esophageal strictures. Anemia and hypoalbuminemia lead to increased infection. Glomerulonephritis secondary to strep infection, and patients readily survive over the 30 years. Therapy is rather unsuccessful and the steroids tend not to work. Management of anesthesia, avoid trauma to the skin and mucous membranes, trauma from tape, pad, BP, cuffs, and etc. Then pemphigus, this is an autoimmune disease where autoantibodies are highly specific and result in the excessive production of proteolytic enzymes that disrupt cells adhesion, leading to separation of epithelial layers. Then pemphigus vulgaris is most common and most clinically important to anesthesiologists because of the occurrence of oral lesions, lesions of the pharynx, larynx, esophagus, conjunctiva, urethra, cervix, and anus also develop. Treatment with corticosteroids and immunosuppressants is highly effective. So this is the end of our lecture. Thank you for your attention.